My name is Spencer Bill, and this is assessment management for a medical patient. First, I'm going to do proper BSI, and I'm going to determine that the scene is safe. What's the situation?
The patient is a 58-year-old male who's suffering from chest pain.
Okay, so the nature of the illness is that my patient has chest pain. There's only one patient. I will request additional EMS resources, and at this time, I don't think it's necessary to have spine stabilization. I'll then move into my primary assessment. I'll determine my patient's level of responsiveness. Sir, what seems to be going on today?
I'm having chest pain.
So he's alert. His airway's fine because he verbalized to me that he has chest pain. Now I'm going to do his pulse and respiratory rate for 1 minute. Okay, his pulse is 85 beats per minute, and his respiratory rate is 11 beats per minute, which is a little low. So I'm going to put him on oxygen with a non-rebreather mask. So he has pulse. Is there any major bleeding?
There's no major bleeding.
I'm going to assess his skin by putting the back of my palm to see if the temperature and moisture are okay. It seems like his skin's cool, clean, and pale. So I'm going to say that he might be going into shock and keep him warm and place him in the proper body position. He is a priority patient at this point, and I'm going to ask for immediate transport to the hospital. Okay, now I'm going to go into my history. Sir, what was going on today when you started feeling this pain?
I was trimming bushes.
Okay. Has there anything you've been done since then that makes you feel better or worse?
Well, it's actually getting a little worse, and no, nothing I've done has been able to make me feel any better.
Okay. And what does it feel like? Is it a sharp pain or dull pain? What is it?
It actually feels like I'm having a weight pressing on my chest.
Okay. How is it only your chest that hurts, or is it in any other part of your body?
Well, actually, my right arm is tingling, and it feels sort of radiates from my chest to my arm.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, what pain level are you at right now?
I would say a 6 or 7.
And how long have you had this pain?
Oh, 20 or 25 minutes.
Okay. Have you taken any medication for the pain today?
No.
And have you ever felt this kind of pain before?
No.
Okay. Do you have any allergies?
No, I do not have any allergies.
Okay. And you said you were trimming your bushes. Was there anything else you might have been doing that could have initiated this pain?
No, just trimming the bushes.
Okay. When did you last eat or drink today?
I had lunch about an hour ago.
Okay. Are you prescribed any medication? I know you haven't taken any today.
Actually, yeah, I'm on cholesterol medicine, and about 18 months ago, my doctor prescribed a nitroglycerin spray because he said I was at risk for angina, but I've never used it. I've never had to use it.
Okay. And that took care of the past pertinent history. Now I'm going to go into my secondary assessment. Sir, I'm going to feel in your chest. Just tell me if this hurts at all.
No, it's just the pressure. It doesn't have any pain, just the pressure on my chest still going on.
Okay. Take 2 deep breaths for me and tell me if that hurts at all.
No, doesn't hurt.
Okay, I'm going to ask you to take 2 deep breaths from me again. And I'm going to listen and see if I hear anything abnormal. Okay, seems to be clear and equal bilaterally. So I'm going to feel in your abdomen and around your pelvis and tell me if that hurts at all.
No, I don't have any pain there, just the chest pressure.
Okay. And psychologically, he seems to be fine. He's talking to me. Now I'm going to take his vital signs. Sir, we already took your pulse and you're on oxygen, so we already have your respiratory rate. I'm going to take your blood pressure. Well, I'll take the blood pressure. Got to make sure the valve on the blood pressure is closed. I pump it up to about 200, and then release the valve slowly. The blood pressure is about 120/80. So my general field impression at this point is that it's most likely a cardiac event. He has pain in his chest, and it's also radiating down his arm. Also, when he breathes, it seems to be clear and equal bilaterally, and he has no pain. He also has been at risk for angina, according to his doctor, and he's prescribed nitroglycerin. So at this point, I'm going to call medical control and see if we can authorize the use of nitroglycerin on this patient.
Medical control authorizes the use of nitroglycerin.
Okay, sir, I'm going to take off your mask for a minute. Is this your medication?
Yes.
Okay. I'm going to spray this in your mouth. Open up for me and raise your tongue. Then we're going to wait 5 minutes and retake his blood pressure and see how the pain level is.
Okay, after 5 minutes, the blood pressure is now 92/52, and the pain has begun to subside in his chest, or the pressure in his chest has begun to subside.
Okay, so we can't give him another spray of nitroglycerin because his blood pressure is too low. And also the pain has subsided substantially, so it seems to be getting better. We'll continue to reassess the vital signs, blood pressure, pulse, and respiratory rate. We'll put him back on the oxygen. We'll continue to assess his skin to see if the color is becoming more pink, becoming more back to normal. And then as additional EMS resources arrive, I'm going to verbalize that this patient is most likely going through a cardiac event. Could be angina because he's been at risk for that. He's on oxygen. We gave him a spray of nitroglycerin. The pain has subsided substantially. The pain was also radiating down his arm, but that seems to have gone away. The blood pressure is too low to have another spray of nitroglycerin right now, but if the pain increases and his blood pressure gets back up, we can use another spray.